Turns out that in his drunken stupor, he cut off a little bit more than the foreskin. Medical professionals, what are some of the worst DIY surgeries you have seen? Not a DIY surgery, but I had a patient with an extremely infected tattoo. A nasty homemade tattoo. It was disgusting. It was full of pus and stank. She then complimented me on my tattoos and asked where I had them done. I said not at home. Not a DIY, and I'm not a doctor, but I know two extremely vain guys, a couple, who traveled to Miami to have bicep implants put in by a budget plastic surgeon. When they woke up from surgery, they were laying on the doctor's office couch. When they arrived home, they got really sick from the infection that set up. My wife and other coworkers took turns caring for them at their house. He couldn't afford to go to a real doctor because he doesn't have any insurance. Eventually he had to go to a real doctor and have the implant removed. Now all that is left is a saggy bicep. Used to work as a nurse in a jail. A woman was convinced there was a tumor in her large intestine, and had to wait a few weeks for a colonoscopy. Became so convinced she was going to die if it wasn't checked immediately, so she stabbed herself in the stomach with a broken-off TV antenna, so she could check. Ended up with a colostomy, didn't have a tumor though. I am not a medical provider, but I had a guy try to pick me up at a bar one night by showing me what a cool guy he was for stitching up his own leg with dental floss. After proudly telling me he did it breaking into his ex-girlfriend's house, he dropped his pants and showed me this angry weeping red pustulant stitch job that stank. I guess he expected me to be impressed. The only impressing thing to me was him telling a potential date he was breaking into his ex-girlfriend's house. One of the few times in my life I was rendered completely speechless. What the hell do you even say to something like that? A drunk man was convinced by his drunk neighbor that he needed to be circumcised. So he cut his foreskin off with a rusty box cutter, that they had sterilized with vodka. 3 days later he calls 911 and we get there to find his penis swollen, purple and oozing pus and blood. Turns out that in his drunken stupor, he cut off a little bit more than the foreskin. Sucks to be him. I interned at a veterinary hospital, and this family came in with their dog. It had a huge nasty looking hole in its back that was poorly sewn up with just regular sewing thread. Apparently their dog had a growth on his back, so they decided to just cut it off with scissors at their house and then sew it up themselves. No anesthesia. They thought it was crazy that they needed 5 people to hold the dog down. Not a medical provider, but I remember seeing the documentary, The Man Whose Arms Exploded, about bodybuilder Greg Valentino. He was a steroid user who became very careless reusing needles and not making sure they were sterile. He got a really bad infection in his arm. He decided to drain the hematoma himself by stabbing his arm with a syringe to draw the pus out. After 20 minutes of self-mutilation and a lot of blood, he ended up in emergency surgery. All his bodybuilding efforts disappeared because they had to cut his bicep off. I volunteered a while at a hospital. Maybe the worst thing I saw was a hiker who'd torn up his shin, stitched it up with a needle and thread from a sewing kit, and went on his merry, unbandaged, showerless, forest camping way, rubbing it with lavender and honey daily. Needless to say, it was pretty infected by the time he came in. I'm a nurse. Saw a girl that got a splinter in her foot on the boardwalk. She tried to dig it out to no avail. The wood she left from that got infected, so she cleaned it with Pine Sol. Obviously, that irritated the tissues even more and it wouldn't heal over, so she decided to cauterize it with a cigarette butt. By the time I saw it, what started out as a tiny splinter hole was now an infected, excoriated, weeping wound taking up half of the sole of her foot. I read medical records for a living. Saw a person have a toe amputated and did not follow up. Several months later, they presented to an ER, where they casually noted they had been soaking the foot in Epsom salts and using iodine in the wound, which of course wasn't closing. So they started putting iodine into the wound and finally realized they might need to see a doctor when they found they could stick the iodine dropper all the way into the wound. One guy wanted a bigger penis. Asked his friends for a method that actually worked. Obeyed them and injected Vaseline into it with a needle. He was smiling when he came into the ER, oblivious to the fact that he was about to lose his genitals forever. Another one I'm glad I haven't seen firsthand while it was happening, a schizophrenic woman who wanted to have another child at all costs, tearing her birth control implant from her arm. All 4 to 5 previous babies had been taken away by CPS within their first months of life, due to severe physical abuse. Had a big patch of skin torn off, it was very hard to close the wound. I'm an EMT and I just ran a call for an 8-year-old boy with severe eye and head pain. Turns out he had a sty in his eye, and his mom decided she would fix it by pouring urine in his eye twice a day for the past week. He had a pretty bad infection. She was utterly clueless and gave us the info about the urine, as though she was proud she was doing everything she could to help him, but that nasty sty was too much for their combined urine to handle. Self-performed orchiectomy, testicle removal. Transitioning gent tried to cut his boys out with scissors and then scoop them out with a spoon. His hope was he would hasten his transition surgery, but he only got as far as cutting his scrotum open and then passing out from pain. Friends brought him into the ER. Honestly, few things make me feel sick from seeing a lot, from being a paramedic, and now with emergency medicine. But, holy hell, that made me hurt just looking at his testicles hanging out of him. I've had a few patients who have had silicone injected into their buttocks by non-doctors, usually in a hotel room by the highway. So they spent their cash on that, and then ended up having horrible infections that required surgery and a long hospital stay. Awesome. Teenage girl decided life isn't worth living anymore and tried to cut her wrist. Thanks to television and movies, she cut the wrong way and only managed to lay open a few layers of skin. The doctor stitched her up nicely, and after a short stay at the local psyche facility she was sent home with some new daily medications. As far as I know, she never attempted again. However, her friends convinced her that doctors hate cutters and intentionally stitch people up wrong to make horrible scars to discourage that behavior. So, she removed her own stitches and stitched herself back up using a sewing needle and some type of fishing line. Her family brought her back to the ER when they realized that the wound was looking infected and just would not stop bleeding. That's when I, the hospital security officer, or healthcare security specialist as we're called nowadays, got involved, as I had to strap her down and all but lay on her to keep her still long enough for the doctor to examine her. Even I could see that she hadn't pulled the wound together properly and that the different layers of skin weren't lined up. She just happened to pull the same doctor who did the original stitches, and he was visibly upset. He carefully removed the fishing line, carefully cut some tissue that had healed incorrectly, carefully lined up the wound, and then carefully went to town with the staple gun, all while I was riding her like a rodeo bull and she was screaming about how we were mutilating her. By the time he was finished, she looked like she was wearing half of a solid metal bracelet around her wrist. Then he wrapped her arm in about 40 times the usual amount of gauze and called for a psyche consult. My dad did some DIY dental work. He had an inflamed wisdom tooth that he refused to do anything about, because he didn't want to spend the money, and he's just a stubborn old guy. He just ate prescription-free painkillers for a while and was hoping the inflammation would go away by itself. Then by the weekend, he went on a hiking/fishing trip in the wilderness, by himself. During the trip, the toothache became worse and worse, as pressure was building up in his jaw by accumulating pus under the tooth. He began to realize that he should have gone to a dentist earlier, but now it was too late. The pain increased for every hour, and after 8 hours of heavy hiking in a bog, he couldn't go any further. The abscess in his jaw was affecting facial nerves, making it difficult to walk, as every step or movement sent a pulse of severe pain through his head, and his vision became distorted. Not until now had he decided to turn back and return to civilization. After a couple of hours of very slow regression through the wet bog to get to his car, he sank down once and for all and could no longer get up. As he was lying there, he soon began to think he was going to die. Completely exhausted with heavy clothes and backpack, unable to move, in a bog many miles from the nearest forest trail, not to mention road, and at least 30 miles from the nearest populated area. The pain was at its peak and he realized he had to do something. He grabbed his hunting knife, 2 inches wide blade, and jabbed it into his mouth, determined to pry out the tooth. He slipped a few times until he managed to get a lever grip, and with all remaining strength, broke the wisdom tooth loose with a loud crack, immediately releasing the pressure from the abscess, and spraying his mouth full of blood and pus. Within a few minutes, his vision returned to normal and the pain declined to a sufferable level. Even though it still hurt like hell, he was finally able to get some rest, and could later return to his car and get home. A subsequent visit to a dentist, a couple of months later, revealed that the roots of the tooth was still left there and had to be removed surgically. The dentist was fairly amused by my dad's stubbornness and DIY dental work, and told him to never try something like this again in the future. When I was a freshman in college, I skateboarded a lot. I fell once, and cut my hand open. Dirt got into the cut, and I really didn't put much effort into keeping it clean. 2 weeks later or so, My hand is swollen and very sore and there is yellow pus leaking from my palm. I went over to my friend's room, and we drank like 5 shots of 151. Then we went into the bathroom, and ran it under scalding hot water for about 5 minutes, to get the flesh all soft. Then he began cutting away everything that looked infected. He got most of it, then got grossed out and threw up onto my hand. I washed it off and it healed normally this time, although I have a scar. Thanks for listening to another episode of DIY Surgery Fails. Hit the subscribe button and activate the notification bell for more instructions on how not to treat yourself when wounded. And don't forget to share your own stories in the comments below.